Welcome to my channel. In this video, I will provide you with all you need to know about Ozempic and Wegovy. This will be beneficial for patients and healthcare professionals. Let's begin. It all began in 2012 when researchers developed a compound called semaglutide for management of type 2 diabetes mellitus. Because of the way this compound worked, it was placed in the drug class called glucagon-like protein-1 receptor agonist, or GLP-1 receptor agonists. Of course, semaglutide was not the first drug in the GLP-1 drug class. There were other drugs in this class used for diabetes, but what's awesome about semaglutide was that it was long-acting, so it was able to be administered once weekly as an injection, compared to the other drugs in the class that was given once daily. After years of research, the FDA in 2017 approved semaglutide under the name Ozempic for type 2 diabetes. The dose of the semaglutide within the Ozempic is 0.5 milligrams, and it's an injectable. You may see lower doses of the Ozempic for type 2 diabetes, and that's because sometimes we start low to see if patients can tolerate it, and then we increase it to the target dose of 0.5 milligrams. Next, I want us to discuss the mechanism of action of semaglutide. Let's see how it works and what effects it causes. This will make us understand why we started using it in diabetic patients and then how it transitioned to becoming one of the most popular drugs for weight loss. GLP-1 is a hormone that is naturally produced in the body. It is mainly secreted by the cells that line your GI tract and smaller amounts by the brain and pancreas. Its function is to stimulate the synthesis and release of insulin in a glucose-dependent manner, meaning whenever your blood sugar increases, the insulin will be released. It increases the feeling of fullness during and between meals by acting on appetite centers in the brain and by slowing the emptying of the stomach. So that makes it feel like there's always food in your stomach most of the time. This is the main cause of the weight loss seen with this drug. Now, semaglutide is literally a photocopy of this GLP-1 in our body, so it has these same effects. That is why we see that weight loss with Ozempic, up to 7% reduction in weight. Now, despite this weight reduction, Ozempic was flying under the radar, really just mainly being used in the diabetic population. Ozempic was not known by the masses until 2021 when the New England Journal of Medicine published a research showing that weekly injections of semaglutide at a higher dose of 2.4 milligrams led to about a 15% weight reduction. This brought a lot of attention to Ozempic, despite the fact that the 15% weight reduction from the research was with the higher dose of semaglutide. After this, there was a surge in the number of physicians prescribing the Ozempic as an off-label drug for weight loss in non-diabetic patients. Off-label meaning the Ozempic is being used for an indication other than the one approved by the FDA. And this is something physicians can do if there is evidence to support the benefit of the drug for that off-label indication that you're using it for. In this case, it made sense because, like we said, the active ingredient for Ozempic is semaglutide. So even though the dose was lower with the original Ozempic compared to the 2.4 milligrams semaglutide in that research, there was still some weight reduction benefits. Ozempic gained more popularity because even celebrities were using it off-label for weight management. In 2021, the FDA approved semaglutide at a dose of 2.4 milligrams for chronic weight management under the brand name Wegovy. So now, instead of using Ozempic off-label for weight management, the physician can simply order Wegovy. Wegovy is indicated specifically for chronic weight management in adults with obesity or overweight with at least one weight-related condition, such as high blood pressure, type 2 diabetes, or high cholesterol, and it must be used in addition to a reduced calorie diet and increased physical activity. Wegovy is administered once weekly on the same day as a subcutaneous injection in the arm, stomach, or thighs. Similar side effects are seen for both Wegovy and Ozempic, which is expected, right? Because they have the same active ingredients, semaglutide. The most common side effects of Ozempic are related to the GI, so nausea, vomiting. The nausea is the most common reported side effect by patients taking these medications. Patients should receive counseling that this class of drugs increases satiety, and nausea may occur if they attempt to eat while feeling full. Patients may also experience abdominal pain, constipation, and diarrhea. As the dose increases, the chances of experiencing these side effects also increases. Now, for more serious but rare side effects, pancreatitis and or gallbladder disease, which can lead to hospitalization. This may present as severe abdominal pain with a possible fever and yellowing of the skin and eyes. These medications put you at risk of low blood sugar, which may manifest as dizziness or lightheadedness, blurry vision, sweating, and increased heart rates. It is recommended to check your blood sugar while you're taking Ozempic or Wegovy. The risk of an acute kidney injury also increases, especially in patients with baseline kidney disease. This is mainly seen in patients who experience vomiting and diarrhea, leading to dehydration and electrolytes imbalances. There are reports of increased risk of diabetes-related retina complications, including vision loss, which thankfully is not permanent. The retina is a key part of your vision. It appears that Ozempic and Wegovy does not directly cause the damage to the eyes. Rather, they may cause rapid lowering of blood sugar. This is well known that any treatment that rapidly lowers blood sugar may initially cause a worsening of diabetic retinopathy. This is because the retina becomes adjusted to higher than normal blood sugars in diabetes, and then when blood sugars drop significantly, the retina becomes starved. The effect wears off as the retina becomes used to the lower blood sugar levels. Furthermore, in the long run, the retina will be healthier with improved blood sugar control. Other serious side effects include gastroparesis or stomach paralysis. Ozempic and Wegovy impact the stomach nerves, affecting the rate of digestion and sometimes slowing down that process too much. When the stomach muscles get very slow or they stop completely, the stomach becomes paralyzed, leading to ongoing nausea, acid reflux, and pain in the stomach and intestines. This side effect has led to several lawsuits against Novodisk, claiming the drug manufacturer downplayed the potential for gastroparesis to become permanent. A very low risk of thyroid cancer has been associated with the use of these drugs, and this is of particular concern to people already diagnosed with cancer. Thankfully, this is quite rare. And finally, let's discuss Ozempic face. Ozempic face are changes in the facial appearance of people who lose a huge amount of weight on these drugs. The term Ozempic face is misleading because this side effect can be seen with other GLP-1 agonists and anything else that causes rapid weight loss. The facial appearance shows increased lines and wrinkles around the forehead, eyes, and mouth, sunken eyes, hollowed cheekbones, sagging skin, especially around the jawline. Reducing the dosage and also drinking lots of water may help with the appearance. Now, before I bring the video to an end, I wanted to quickly discuss how long patients usually stay on these medications and what happens after they stop them. Ozempic and Wegovy have been shown in studies to be efficacious for up to 3 years. But most people stop it within a year because of the cost and side effects. After stopping these medications, there will be an increase in the appetite, some blood sugar spikes, which will ultimately lead to weight gain, which is seen in most people who end up stopping the drug. The weight usually comes back, but overall there is weight reduction compared to the baseline weights. And that'll be all, folks. I hope you learned a thing or two. If you did, make sure to hit the like button, subscribe for more videos like these, and leave a comment or question down below. Thank you for watching this video, and take care.